Keeping you health aware, February is American Heart Month, and it is a great time to discuss the treatment options for heart disease, the leading cause of death in the U.S. So joining us now, we have cardiothoracic surgeon Dr. John Evans of Christus Health. Doctor, thank you so much for joining us today.
Yes, ma'am. Thank you for having me.
Let's talk a little bit about coronary artery disease, what we need to know.
Yeah, well, coronary artery disease is a disease of the blood vessels that feed blood to the heart. Over time, those vessels can narrow due to plaque buildup from high cholesterol, calcium, things like that. If you're a smoker, certainly you can add to those plaques. That limits the blood flow to the heart, and then over time that can lead to a lack of blood flow to the heart where the heart doesn't get enough blood flow, and as a result, you can have chest pain, shortness of breath, things like that. If that artery itself were to fully block up, you can get a heart attack.
And there are several different treatments that you can use for coronary artery disease. We hear about a lot, different medications, stenting, and even surgery sometimes.
That's right. So the first line of therapy is medicines. So that can be prescribed by a primary care doctor or a cardiologist. Things like blood thinners, lipid lowering or cholesterol lowering medicines, blood pressure reducing medicine, things like that. Next is something that is done by an interventional cardiologist, either ballooning or stenting a blockage in the heart artery. That is where the cardiologist, through poke holes in the groin or through the wrist, will use catheters and wires to go up from that artery in the hand or the leg to engage the heart arteries, cross that blockage, and deploy a stent. That stent is wound over a balloon tightly on that wire, and when they balloon that stent, the stent expands and it squashes that plaque or that narrowing and restores blood flow to the heart. And then lastly is bypass surgery, open heart bypass surgery, where the surgeon divides the breastbone, gets the heart exposed, takes arteries or veins from the body, and bypasses that blockage. He'll open up the artery downstream of the blockage and use an artery or vein to sew onto the heart artery and restore blood flow downstream of the blockage.
Now, obviously, the average person may not realize that they have a blockage going on, but what are some symptoms that could be a red flag that we need to go see the doctor and have our heart examined?
Yeah, symptoms. So symptoms that are most classical are chest pain. When you're exerting yourself physically, you start to have some chest pain, have some shortness of breath, pain that radiates down the arm, up the jaw, things like that are typical. Unfortunately, not everybody presents like that. Females, diabetics, a lot of times don't have chest pain or any classic symptoms. So it's good to know your family history, know if your mother, father, grandparents had heart disease, and then know your numbers, know what your cholesterol is, your blood sugar, your blood pressure, things of that nature.
What are some daily steps that we can take to make sure that we're being as heart healthy as possible?
Number one, and the number one cause of preventable death in this country is smoking. So if you smoke, there's a hard and fast answer there. Stop smoking. But also eating lifestyle choices. So eating healthy, low-fat diet, low-salt diet, exercising, and then just knowing your genetic makeup, knowing where you come from, your family history. So, sadly, you can be as healthy as you want to be. We even operate on marathon runners, unfortunately, who do everything perfect, but still have coronary disease. So knowing kind of the genetic makeup, your family history, and seeing a primary care doctor or cardiologist if you are at risk of heart disease.
So really making sure that you've got the knowledge and that you're doing everything you can.
That's right.
All right. Well, doctor, thank you so much for sharing all this information with us and with our viewers. Of course, we encourage everybody to go ahead and make sure to take a moment to check your heart health. And speaking of heart health, over the weekend, KSLA's very own Dominique Ben hosted an event to bring awareness to heart disease. She was the mistress of ceremonies for the Janiyah Strong Foundation's 3rd annual Red Out Gala. Now, little Janiyah was born with a cardioarction of the aorta, a narrowing of the aorta, the main artery that carries blood from the heart to the body. Now, she had surgery at just 3 months old, and the event raised money for the foundation to help other children like her. And today, she is a very active and healthy 2-year-old.